walk me through kind of your background. Have you always been a contact tracer, or are you doing it specifically because of COVID?
Yeah, I'm an epidemiologist. I'm one of the communicable disease epidemiologists with DPH, with the Department of Public Health. And so typically in my pre-COVID life, I did a lot of data work. I focused primarily on vector-borne illness, but once COVID started, we sort of all jumped into the fray. And from the beginning, I think I just got put in this part of the response and have stayed there ever since.
And what has it been like?
This has been the most insane couple of months that I think any of us have ever experienced. We didn't realize it was going to be anything like this, and we are doing our best, and it's pretty crazy to live through it.
Is it possible to keep up with every case and getting all of their contacts and quarantining those people? What is the scope and the magnitude of the work?
It is possible if you have all of the right tools in place. So when this first started, we knew pretty quickly that we needed to put an infrastructure in place. So we did that. We built our own database, using a system that we actually had not had any experience in before, but we learned pretty fast. And we built something that I think we can be pretty proud of, actually, and we've been expanding it ever since. So we put that infrastructure in place, and then we started really seeing a lot of cases. And at that point, we realized, okay, we've got our infrastructure, now we need people. We need people to come in and make these calls. So we did our first round of hiring. We hired some folks from the city and the county. We wanted to keep it local. People really know the area that way. And so we brought people in, and we developed a training program, and we trained them up. And now it's just a matter of trying to keep all of the balls in the air at the same time. So right now, it's been pretty widely publicized around the country that there are some lab testing delays. So those lab testing delays, combined with a legitimate increase in cases here in St. Louis and Missouri, many places all over the country, we are now bringing on more people to meet that increased demand. And we're also seeing more businesses. That's another part of it that I work with. And so we need to train people differently to work with businesses or group exposures. So we're trying to train up people to do that, and just try to meet the demand, but it's hard. It's really hard.
There's so much there that I want to follow up on. So let's start with the hiring.
Okay.
How many people did you hire, and how many more people do you plan to hire?
I don't know if Sarah's here. If you're still listening, I don't know the exact numbers. I know with our first round, we hired something like 42 or 43. There were a couple of people that did not come on. Some people ended up not accepting the offer, things like that. So we have most of those people on, and the thing is that we've trained them, and I'm sure we'll go into this in a little bit, but there is the part of the process that starts with receipt of a positive lab test and data entry and case investigation all the way through to the end. There's really many steps in that process. And so what we're trying to do is train our new people to be able to participate in many of those steps so that we can be really agile in our response. If we have a surge in cases, they can do case investigations. If we have businesses or contacts, we can do that. And so we brought on those 40 or so people. We also have volunteers. We're even bringing on more volunteers now too. Many of them are students, nursing students or MPH students, and we're in the process of hiring a number of new people, but I don't know that exact number, and I don't want to give any number that I'm not sure of.
That's totally fair. I understand.
And we also have a bunch of DPH employees working too. So we've been able to really take advantage of the staff as well, which is great.
Oh, the State Department of Public Health?
Oh no, our St. Louis County Department of Public Health. And so we've pulled our restaurant inspectors. We've pulled people from our health education department. We've pulled people from clinics if they're doing work that is not maybe as many clients now. So we've been able to pull people from all over within DPH.
So it's all hands on deck.
All hands on deck since March.
We're at about 60, Jenna. We've got about 60 hired, and we're still looking to hire more. But we're at around 60. So Amanda was pretty close.
Awesome. Thank you. In terms of the testing delays that we have all heard about and seen, how does that make your job more difficult?
Well, think about this from, let's think about from the timeline that this would start out with. So someone starts developing symptoms on day 1. Maybe they go and get tested on day 3. If they were to get the results back within 24 hours, that would be great. But we're now seeing people taking 5, 6, 7 or more days to get their positive test results back. And that means that we at DPH don't hear about those test results until they come back. And sometimes it's even a couple days after that in order for the lab to get into our system. So at this point, we're at least at day 7. We really do our best to get to everyone within 24 hours, but when we're seeing a surge of cases like this, we do prioritize people who are higher risk or lower risk. And how we define that is dependent on the epidemiology of the outbreak at that time in St. Louis County. But we prioritize and get to our high risk cases first. So it could be a couple of days before we get to somebody who is a little bit lower risk, even after we get that. So now we could be at day 10. At that point, we're eliciting that person's contacts, close contacts, household contacts, and non-household contacts. We then have to be able to reach out to those people. And not everybody, as you can imagine, answers the phone on the first time we call them. So sometimes it can be a couple more days before we get to the contacts. If these contacts are at a 14-day quarantine period from the time that they were last exposed to that case, it could be day 14 before we're even able to get them on the phone. And a lot of that starts out with a testing delay of 5 to 7 days. And we could get this process, we could shrink this process and just cut off that first part if we didn't have the testing delays. There are delays throughout the process though. I mean, I want to be clear about that.
What do you mean by throughout the process? What are other delays you're seeing?
So, again, this is where we prioritize our cases. So the testing delays are the start of this, and that's what really puts us behind from the get-go. But, as we see the cases really dramatically increasing in St. Louis County and all over the region, that means we really need to mobilize our resources to get in touch with these folks as quickly as we can. And if they aren't part of that high-risk group, it may be a little more than 24 hours before we get in touch with somebody. And that is if they answer the phone. They have to answer the phone when we call. Not everyone does. They have to call us back if they get a message. We do try them a number of times, but we could have the wrong phone number. That's another problem. So,
have you had cases where, someone who has COVID was out and about spreading it, not knowing they had it because they were waiting for their test results, and that compounded with every contact they had because of the delay?
Yes, and the recommendation is for anyone who gets tested to self-isolate until those test results come back. Those are people who are symptomatic or asymptomatic. That message, I think, does not necessarily get out there as much as it should. If you are getting a COVID test, you need to be isolated in your home until those results come back. And your close contacts, if they know about your test and they know about their potential exposure, should sort of preemptively quarantine themselves until those results come back as well.
You also mentioned businesses and kind of adjusting to accommodate perhaps mass exposures because of people in businesses. Is that something you're seeing more of now that we're all kind of back open?
It is. When we first did this, and I don't have the data, the numbers right in front of me, but when we first did this and we were still under the stay-at-home order, primarily we were seeing people who had a couple of household contacts. Now we have those household contacts, but more people are back to work, so we have workplace exposures. A lot of times people are really, really good about wearing masks when they're public-facing, but then they might go into a break room with their coworkers and have lunch. We've seen sometimes in situations where maybe the social distancing isn't great. We've had one case expose 50 or 60 people at a business. And then we work with people. People go to parties, people go to brunches, people go to weddings. We've seen all of these things more and more in the last couple of weeks. And we have to figure out our best way to work with the business or the family member who threw the party to figure out how to get in touch with those contacts as best as possible.
Are there people that you just haven't been able to get in touch with, or have you been able to make contact with everyone?
There are always going to be people, and this isn't COVID specific. This is, in communicable diseases in general, with all of the reportable conditions, we're never able to get in touch with everybody that we need to. So we have processes in place. We send letters to people that we're unable to reach. And we use those processes to follow up. We do often get calls back with somebody saying, I got this letter that said I was a case, and I didn't even know you called me, and it's because we had the wrong phone number or an outdated phone number or something like that. So we are not ever able to reach everyone, but we do our best to get in touch with as many people as we can.
Based on what you guys have been experiencing and the trends you've been seeing, what do you want people watching this to know, and what do you want them to do to keep cases down, to be safe?
Thank you for asking that question. Because I come from the contact tracing side of this as opposed to the case investigation side of this. So one of the things that I really want people to think about in their personal lives is how we define a close contact. So we define close contact with someone as being within 6 feet for 15 minutes or more, or having direct contact with respiratory droplets. So that's kissing, shouting, sharing a drink, things like that. And I would like people to keep that definition in mind as they go through their regular life. It sounds a little bit dorky, but when you're somewhere, when you're at a restaurant, or you're at the grocery store, look around and say, if I were a case right now, who would my close contacts be? If that guy over there was a case, would I be his close contact? And use that to sort of guide the way that you wear your mask. Always wear your mask when you're out in public. Wash your hands frequently, and just think about who you would have as a close contact in your life and try to minimize that. The other thing that I would say is, if you do get a test, isolate until those test results come back. Especially if you are symptomatic. We don't want you out there. If you had a reason, if you were exposed to someone, if you're a contact, pay attention to your quarantine, pay attention to your isolation, and just don't put others at risk unnecessarily.
Here's a question from a mask standpoint, because I'm curious, and I think a lot of people probably are. If I'm wearing a mask and I go and get my hair done, and then it turns out that I have COVID, is that person who did my hair, is she, in jeopardy of catching it? You let her know, and what role does the mask play in the risk factor there, I guess?
That's another really good question, and we have good data. We have for a very long time about how surgical masks or N95 masks, how well they protect people. What we don't have a lot of really clear data right now are things like cloth face coverings. We certainly know without a doubt that a face covering is protective. It's protective of you, it's protective of those around you. We don't, CDC and science and DPH right now, we keep looking at the evidence that's out there to try to see if we can really get down to what cloth face coverings can do, aside, in comparison to the N95s or surgical masks. And we don't really know is the answer right now. But what I will say is, if there is a mask shortage, which there was at the beginning of COVID, we want to keep those N95s, those surgical masks, reserved for healthcare workers, first responders, things like that. Right now, that is not the situation we're in today in St. Louis. People do have access to surgical type masks. We've given them out at St. Louis County, for example. I think that those are great if you have access to them. If you don't have access to them, a cloth face covering is also recommended. If you were at your hairdresser, to go back to your original question, so you have on a cloth face covering and your hairdresser has on a cloth face covering, we would consider you guys close contacts. We would be very clear with both you and your hairdresser when we did the investigation that we think that the transmission rate has been lowered because of the fact that you've been wearing your masks, but we do still consider you close contacts.
Okay, I think that's important context for people to have, because I don't know, I cover this every day and I'm still kind of like, oh, I don't know if I'd be considered a close contact or not if we're all wearing masks.
Well, and I think I cover this every day too. I talk to people every day about this, and we really do try to stay up with the science on this.
Yeah.
And you can scour the CDC website, and today with July, what is it, 13th, 14th?
Yeah,
the evidence is not clear today on what that looks like. So.
Based on what you're seeing in terms of trends, what are your biggest concerns going forward? What are you guys preparing for in the contact tracing realm?
So are you saying from like a societal perspective or from the health department's perspective?
Either, both.
Okay.
If you have a few thoughts, that's great.
Well, from a health department's perspective and from a very specific view of what I do every day in my job, my main focus is to figure out a way to get our response tailored to the epidemiology of the outbreak where we are today, and make sure that we're getting in touch with our cases and their close contacts in a timely manner. It is not helpful if we get in touch with a contact 3 weeks after they were exposed. We need to get in touch with cases and contacts in time for our discussion with them to have an impact on their lives, which then has an impact on the community. If we can talk to them and get them into quarantine, into isolation, especially if they didn't know that that was something that they needed to do, that's what we need to do, and we need to do it quickly. From a larger perspective, from a societal perspective, I would really like to see people just being careful when they're out in public, wearing their masks, washing their hands. You can go out these days. That is what we're allowed to do in St. Louis County, but be thoughtful when you go out about who you're with and who you could potentially be exposing. And if you do experience symptoms, think about the process that you need to take. Think about getting tested. Think about being on isolation, and be upfront with, with any of your contacts that you might have exposed. And if you get a call from the health department, pick up the phone.
Pick up the phone.
Pick up the phone if we call.
I've seen a couple of these web charts, for lack of a better term, of saying like, here's one patient who exposed this patient to that patient, and kind of like where it all spouts off. Mm-hmm. Do you have a number of like your biggest spread yet? Is there something anecdotally we could tell people, like, here, this one person exposed this person who exposed those people, to kind of put it in perspective?
I think we've seen enough. I couldn't tell you what our biggest one was, but I can tell you several examples that we've had of situations where we've seen significant transmission. And some of these, Dr. Page has talked about in his media briefing. Sarah's probably talked about them too. So we have, lately we've been seeing some public gatherings. I think Dr. Page talked about one this week where there was a group of young people that were out doing an outdoor social activity. Somebody was positive, and I think 15 of them ended up testing positive after that. Now, those 15 could have gone home. If they were asymptomatic, they could have been going to work. They could have been exposing family members, older family members who might be at higher risk. So that's an example of a situation. We had a situation where one person worked in a large sort of warehouse facility, and they weren't practicing good social distancing. They weren't wearing masks. And one person ended up having 55 contacts. We were able to identify those 55 contacts and working with the facility and get in touch with those folks. But that is a pretty significant impact on the business if we put 55 people out on quarantine for 14 days. These are big impacts that a few smaller decisions can have.
Anything else I'm missing that you think is important to share?
I think you covered. Oh, Sarah?
Yeah, I was just saying, I think maybe just say something about like caution fatigue. I know people are tired of being cautious and tired of COVID and tired of wearing masks, but if anything, now is more important than ever. So we don't close the economy down. Don't go backwards. We don't want to take steps backwards. We want to keep moving forward. So if anything, it's just important to stress, we understand that people are frustrated. We understand people are tired, and we understand this is hard. But masking up is the best possible thing that we can do, and we just can't stress that. It's not like we enjoy this any more than anybody else. Unfortunately, we're just the bad guys in this position to help. So I don't know, Amanda, if you wanted to kind of say something on that. I think that's just really important we empathize and we feel what everybody's going through, and we know that everyone's tired of COVID, but it's just, we just have to keep going.
Well, Sarah, you just said it.
You can use an SVO, I guess, or yeah.
But Sarah's really, I think, hit the nail right on its proverbial head for that one. We're all tired of this. I'm tired of this. It's really hot out. I don't like wearing a mask when it's really hot out, but it's something we have to do. We really empathize with everybody. We're tired of this, and you're tired of this, and businesses are tired of this, and it doesn't appear that it's going away anytime soon. We need to make some of these things part of our daily routine and get used to keeping ourselves, our families, and our communities safe at this point. Now more than ever, it's important to stay on top of those protective behaviors.
And while you're encouraging, obviously, mask wearing and everyone being aware, you are still planning to ramp up your response, anticipating that you will need more contact tracers as this continues.
Yes, and if these last couple of weeks have shown us anything, it's that none of this is predictable. Some of it you can use common sense and say, okay, if people are more out and about, we might see more transmission. But the extent to how that happens and exactly who we see these increases in cases in, we're still learning along with everybody else in how that goes. And that's why we're trying our best to, like I said before, we have this agile response. We're cross-training all of our new employees, all of our new hires and our volunteers to do case investigation, to do contact investigation, to do data entry, to call businesses. That's a little bit more specialized, but we're training people to do every part of this response so that if it's a time where we're surging in cases, we can move people into that part of the response. If it's a time where we're controlling our cases but businesses are exploding, then we'll move people into that part of the response, and just do our best to meet the current needs of the outbreak at that time.